little laid back. I am really very private and low key. But I would say my most admirable quality is being a self-identified lover. Yeah, I'm definitely a lover of family and community. You know, every day someone's parent, child, or spouse becomes gravely and suddenly ill. And they're totally unprepared to take care of their care at home and communicate with their doctors and nurses to communicate back the progress of how they're doing. And I just thought there's got to be a better way to do this. So in my case, it was my parent, and I looked for ways that this situation could be different. When my mother fell ill, a lot of the patient portals were starting to roll out. And while they're good for checking your lab tests, appointments, and medications, they don't really provide a way to guide you through your care. They're more informational and totally not instructional, and just fall short in a virtual care model. One of the biggest surprises is more healthcare institutions than I thought are still executing a blockbuster video model in a Netflix world. And while that's okay for trauma care, many healthcare services today can be delivered in a virtual care model. So that surprised me. And the aha moment with our product CareScriptions, which is a virtual care connected care platform, was when we were rolling out our beta with MD Anderson. And I realized that our platform essentially could facilitate better communication between the patient, family, and clinical team to have a different outcome. And at that point, I knew we were onto something. Yeah, at this point, most healthcare delivery organizations realize that they are going to be a beneficiary or a casualty of digital healthcare. So many of them are really moving to a more value-based care model. And we see the next 2 to 3 years as high adoption for these organizations, and an incredible opportunity for us to work with them to move from a fee-for-service model to a value-based and virtual care model. One of the things that we're seeing with high deductibles, high co-pays, and just the uncertainty of health plans in the marketplace, in the healthcare plan marketplace, many consumers are starting to shop healthcare services, and they're really looking and starting to compare different hospitals and clinics and healthcare delivery organizations. And they're starting to take more of a proactive approach to their care. And they actually are becoming the disruptives of healthcare. So that is really an amazing event, because they're going to push the traditional healthcare providers to do more faster. So Medwell is an established expert in spine and orthopedic surgery. They have an amazing track record of helping their clients deliver exceptional quality care. And we are absolutely pleased to have them as a partner. We look forward to working with them as they help their clients move to value-based care models, introduce digital technology into their workflows, and help optimize the care delivery of their patients and improve outcomes for all of their clients. This is going to be an amazing partnership. So with the expertise of Medwell, our connected virtual care platform, a melding of expertise and technology, as well as the capability and services to help deliver this, is really going to change the game for the Medwell clients as they really introduce digital companion apps into their practice and digital therapies to help their patients better self-care. As wearables become more advanced and mobile devices become more accessible, we are going to implement artificial intelligence and machine learning to collaborate with those technologies in a more effective way and really up our game to help remotely monitor patients, to help them report back on symptoms, vitals, outcomes in a way that will provide some just potent data on the status of patients, help inform clinical teams on how to deliver better care going forward. Yeah, so I would say Seremedi in delivering CareScriptions has allowed us to deliver on that commitment to provide the market, clinical teams, families, patients with better tools to help manage their care in remote settings, to help report back. And I think that as we really move and increase our adoption, we will just really be well positioned for hyper growth. We'll be better positioned to collect data and turn that into meaningful data that really changes the industry. Our Seremedi's CareScriptions platform is completely configurable. So essentially, we can be help clinical teams be extremely targeted. They can push out to their patients, this is what I want you to do from the time you wake up to the time you go to bed. This is how I want you to do it, when I want you to do it, why I want you to do it. Also, here's the information that I need to make sure that you're on track and progressing with your treatment. So it is extremely efficient. It allows clinicians to pull little data out of big data to really change outcomes in a way that other solutions are not doing that today. I am just really excited about the MedWell and Seremedi partnership. I think we are just going to really make a difference in spine and orthopedic surgery in that whole industry is as it moves to a virtual care model. I think we're going to be pivotal in accelerating that, and I'm pleased to work with that team.